I'm Dianne Timmering. I'm Vice President of Spirituality and Legislative Affairs, and so delighted to have my dear colleague, friend, and partner, Kathy Owens, our Chief Nursing Officer. And we are delighted because a couple of days ago, we also put on our little panel discussion, Dan Rash, who is the DON at Laurelwood up in Maryland. So Maryland, us Kentuckians, Tennesseans, and Marylanders are very happy now for the change of season. We're starting to feel a little bit of warmth, right, Dan?
All the snow is finally going. I can see the green grass.
Yes, we've had lots of snow. So without further ado, let's get started. And I mean, I'm talking to the clinicians out there. We love our DONs. We love our DON partners and our clinical partners. Awesome DON meeting today, or this week. And really 6 months ago when we talked, and Kathy allowed me to talk to you all, that honor, we talked about what if, just imagine, what does this partnership really look like? What if we were to pray over pressure wounds? What if we were to do guided imagery around pain management? What if we were able to really bring in that unique spiritual intervention around the care that we give and make it non-pharmacological, in fact, and really care plan it? Because not just right now it's a lot of organic discussion and dialogue that goes on. You know, a lot of times, Kath, we're part of the QA process. Mm-hmm. We understand the residents who are at risk. But Kathy and I, this is really, I know it's a fantastic dream of her heart as well, to go to the next level of not just an organic care plan, but a formalized care plan process. And we want to really speak to you about being tactical around that. We also hope you enjoyed the palliative care session. I appreciate your work on the palliative care work just prior, and the team was great on that. And we're so excited to be partnering with you on that as well, just because that whole, as you say, affirm their life. Mm-hmm. You know, that piece of their journey, mm-hmm. that life journey, to be able to plug into their every spiritual need, mm-hmm. as well as the family. And also, it's it'll be a core advantage for us. I think it's a contribution margin as well as a COP, as a program of distinction. A POD, I should say. So, Cass, so anyway, I know we're so excited, so let's get started.
All right.
What are your thoughts around this?
Oh, well, I've got a million thoughts, but just like you, this is a dream come true for me. How many times have we said, like, there's been moments when we've been working through how does this work and what have you, and I've told Dianne on several occasions, I am just thankful to be on the phone with the VP of Spirituality. I mean, it's like,
she's like, stop this conversation.
I got to stop and enjoy the moment.
I'm just happy to talk to a VP of Spirituality. I forgot about that.
It's like, this is so cool. I don't care, whatever we need to get done. This is like so fun. So it is a dream of mine. And, I think we're so inextricably linked, our spiritual being with our personal and physical needs. And I think that to really execute on the whole holistic that David was talking about and Keitha Hunter had talked about, the holistic component of what we do. So this to me just fills in that circle so wonderfully, and there are some awesome opportunities that have not totally been explored in our world, and so in some ways we're sort of new at this. I think you all have been doing it longer than me. I just joined the organization, but there's been, I can't wait to hear from Dan on his experience and how Dan's actually been integrating this into your world, and it just brings the whole concept of meaningfulness to bear. I think when we're delivering care, it can be so routine and rote and and sometimes necessarily so. But the spirituality partnership just brings a depth.
It does. So and Malou, one of your great SCCs, said to me one time, this was many years ago, when Carol and I and the team, we were in the field really trying to promote this partnership. She said to me one time, she said, Dianne, help us be creative. Mm-hmm. Help us be creative in interventions. I will never forget that moment. We were in Florida, And I was so grateful for it because that really sort of elicited this growing more, not just organic partnership that which is organic and beautiful in the field, but really formalizing it to a whole level of true holistic effectiveness. So Dan, why don't you talk about, so you're a little revolutionary in how you're utilizing Dee and your chaplain. Talk about it both personally, because I know you and Dee have an awesome, there is some, how you all integrate personally, but also professionally, how you utilize it, kind of to start your day and then to also take care of your day, take care of the patient related to behaviors and other aspects of care.
She really keeps our facility together, and it starts with me and it goes down to the residents. But when I'm having a really, really bad day, I can come into her office. She has the most comfortable chair you could imagine, and I speak to her like I would my pastor. And she listens to what I have to say, and it's a non-judgmental approach. She offers her own insights onto how she feels I can spiritually make myself better and how I can heal myself. Because when I am in good shape, both physically, mentally, and spiritually, then I can help my staff to do the same way. Because we're taking care of other people. And I know that Joe Steyer brought up in our DON conference the concept of us not taking care of ourselves because we're dedicating all that to the residents. And I find that I am much more productive and effective once I feel like I am spiritually well as well. But as far as clinically, we've had some really difficult patients who we have tried over and over every single kind of intervention we could possibly do. We go down a list of interventions. I've been doing this for a long time, and we had a resident who had 8 falls in January. And we just kind of threw up our hands and said, what else can we do for this gentleman? And Dee had just come back from her own conference, and she said, I can go in there and talk to him. And so she went in there, and we were able to get him down to 2 falls this past month, which is a huge improvement. My head of my falls committee, who's my ADON, Justin, he has integrated where it's a more proactive approach for every person who is at a high fall risk when they come in, or everybody who suffers a fall now gets a spiritual intervention. And it's just Dee going in there and talking to them and trying to get to the root cause of why they're falling, because they open up to her a lot more than they open up to me sometimes. It could be something just buried deep down inside that they don't want to share with us, and they would share it to her. So
Isn't one of the causes, Dan, one of the causes was they wanted to be noticed? Didn't one of the residents say that they wanted to be noticed?
It was almost a competition between this particular resident and his roommate on who could have the most falls. And one of them would fall within 24 hours, the next one would be on the floor. And it come to find out that's what it was. He felt like the roommate was getting all the attention, so he wanted to be the center of attention at that point. So that's why he put himself on the floor.
So does Dee also attend your QA or your at-risk meetings? Because you are preventing a negative act from happening. You are preventing a fall from happening. That's very powerful, because if you think of the butterfly effect, right, then you don't have a broken hip. You don't have an angry family member. You don't have an 18-month convalescing period. So you're really stopping bad things from happening.
Right, she does attend both meetings. And we do discuss all the negative outcomes in the morning at our clinical meeting, and she's there for that as well. And a lot of times, it's just kind of her taking a non-clinical look at the whole situation. You know, back in nursing school, and I know Kathy can attest to this, they teach you how to treat the diagnosis and not necessarily treating the person. And you can look at the labs all day, you can look at the x-ray results, but what is the real reason why this person is depressed, or why they're losing weight, or why that wound won't get any better? And Dee has forced me to kind of step out of my shoes and evaluate the whole situation holistically.
Dan, I think I'm going to recruit you for the Department of Spirituality. Sorry, my friend. You are so awesome. I think we'll have him do his own little webinar on the whole program.
Yep.
So we're talking
Actually,
prevention.
we can do that.
Yes.
So Dan, you're on notice. We're going to bring you on to the clinical webinars. It's an excellent suggestion.
So really what we're talking about is bringing in hope in medicine. I mean, based on his outcomes, there is scientific evidence now that we could actually, this is evidence-based where he's actually prevented falls. So, I mean, this is really working for him, right? So that would show up on the scorecard as a positive, a reduction in falls, as well as, fewer falls, right? So you can see how the spirituality impacts, it impacts the specific action and event, but it also impacts your QMs. Why don't you talk about that?
Absolutely. And first of all, it strikes me, based on what Dan said, a few things I just want to comment on. I really thought it was just wonderful that the chaplain is there to help the team actually take care of themselves, and it's a safe location for people to go, and that came to mind as you were talking, Dan, as well as when you're talking about the residents and your elders sharing the real root cause for maybe what's going on with them. That to me also screams safety, and that's an important need of people, especially when they're in an environment that may not be completely familiar, or at times can be even just darn right intimidating. And I think that the presence, I always think about the presence of the chaplain being such a powerful piece. Well, as we're sitting here talking, I just had a thought. This is somewhat extemporaneous, but I don't know if anyone's ever read anything with the I Ching. It's the Confucian practice in China and in Asia, and there's one particular element in the I Ching that talks about the wisest of sages can walk through a town or a village and utter not a word, but the village is changed forever. And when I think of that, I think of the presence of our chaplains, and just their mere presence actually can have such an impact in the facility and with the resident and the family.
Really promote the power of presence, the power of being there. Sometimes it's not a word at all. It's just that being, yes, very well said.
Yeah, it's very exciting. And so when I think about this is, I've done a lot of reading on this. I love Larry Dossey's work. I don't know if anyone's read that, the healing power of prayer, and just the power of intent, and just really thinking in terms of the level of anxiety and angst and fear that our residents, our caregivers, our family members, our elders are all experiencing. And when you look at the metabolic effect in the system, that actually can contribute to what they may already be experiencing in terms of pain. It can also be a very distracting element in their world, so that being able to maintain a level of safety awareness that's critical to prevent falls, having that calmness, that once again, that sense of security, that sense of spiritual connection, I believe if we looked at it, we'd see metabolic effect. And
absolutely.
And that has a chain of events and a ripple effect on a person's existence that will contribute to, I could go down every one of our quality measures and demonstrate how that actually has an impact.
Well, let's talk about, Dan, I mean, you have residents with anxiety. You brought up depression. I would say the depression and anxiety is just something that we really want to tackle to a whole new level. And I mean, that's where you get your 13 or more meds, you get your increased antipsychotics. So if we're truly going to be a powerful non-pharmacological intervention, I mean, really formalizing some of that programming around it and really formalizing that in a care plan, which we'll talk about that in a minute, some of the language around that team, that can really empower you and your team to deal with some of these really, horrible conditions that are emotional, that our customer, our patient population experiences. Dan, why don't you talk about, I know you and Dee also work around depression and pain management and anxiety, so why don't you talk about an intervention that you all have come up with?
Sure, absolutely. We have a specific resident who was here a few months ago as a short-term resident, ended up not succeeding at home, so she came back to live with us here at Laurelwood. And immediately she just kind of shut down into a shell, was not the same person that she was. She developed a pressure sore and she's lost a significant amount of weight. And once we really got down to the bottom of it, she was lonely and she just felt the loss of the independence was so overwhelming. And so Dee has been able to go in. Luckily, her room is right by Dee's office, but she can go in there and talk to her. And since then, she's actually put some weight back on. She's getting up and she's coming to activities. Her pressure sore has been healed. And a lot of that just came through prayer, because it let her know that even though she's not at home with her family, we're here, we're her family. And the spiritual part with God as her, overseer has let her know that she's not alone. And I think that we've been able to get better clinical outcomes because of that. We have another particular resident who actually committed suicide or attempted suicide twice last year. And she just does not feel like anybody is watching over her. And so we go in there every single day and we hold her hand and we pray. And you just see it come over her face immediately, because she knows at that point everything is fine. And she's getting up and she's going to activities and she's put some weight back on. And we've been able to get her off some of her antipsychotic medications that she came into the facility with.
Now, you're so brilliant again. Thank you for your articulation. I could just cry. You said it so well. He's brought up so many good points, but first of all, we go in and pray with her. You have the right to pray with the residents, the family members. You have permission to pray. It's not just the chaplain. The chaplain is one person. You are an army. You're an army. You are armed with that beauty and that skill set of asking of prayer. So I love that. That is so empowering, number one. Number two, think about the QM's team he's impacting. The depression, impacting the depression. Mitigating the depression and the anxiety is doing what, Kath? Putting on weight.
Yep.
Reducing pressure sores, because what? She's physically, metabolically. Now she's physically active again. She's walking around. Blood circulation.
It reduces stress.
Yes.
It can reduce the cortisol levels,
yes,
which all have a negative impact on how the body metabolizes, and impact on insulin resistance. There's a lot of different potentially related factors that could play in here just by addressing someone's anxiety and stress.
It's just like I'm so glad you brought that up, and his examples were perfect. Addressing that impacted, just the power of prayer helped to, and the power of visitation, the power of presence, all impacted these things to create hope. So you get up and you walk around. Your pressure sore goes away. You gain weight. Just really beautiful, dynamic stuff. Well done.
Well, and really, Dan. First of all, I just want to commend you, Dan and Dee, for being willing to be pioneers in this effort, and to actually be bold enough to talk about it openly. Because I think we are hopefully getting to an age where this is more okay to actually be visible with in the clinical workplace. It's not, and we know that our workplace is really the resident and elder's home.
Yes.
So it actually does even feel like it fits better. Yeah. But it does take a level of boldness to do this. So I want to acknowledge that. The other piece, as both of you all were talking, that came to mind, and it was some of what we talked about. Joe and Dianne did a phenomenal job unveiling some of their books.
Power of the
Ask this week with the directors.
Thank you for being with us, everybody.
Yeah, it was really awesome, and I think for me it touched a lot of. It just resonated so strongly.
Thank you so much.
And I love the idea of the power of the ask and the associated power of intent. And I keep thinking about what we talked about.
It's like a core competency, isn't it?
It is. Well, and when they've done research on the power of intent, it is such an important element of really being able to communicate with others or connect with others in a spiritual way. Right, and it's also an element with the healing process, and as well as I think of our chaplains. I want to say this again. I said it the other day, but it was like a light that shone for me during the conference. Is I do believe in the power of prayerful intent, the power of prayerful meditation, the power of meditation. Really, whatever kind of faith-based background you come from, there is always an element of that focused meditation, prayerful meditation. And I think of our chaplains as our resident experts. And I think when the presence that you feel when someone who has really worked on, because it's a skill, and it takes work.
Skill.
It takes work to do the focus, because it's so easy to be distracted, especially in our ADD society. And especially for me, I'm like, oh, okay. Thought go away, because I got to focus. And for me, it's always a calming. I've actually had the experience of being in several signature centers over the last 6 months, and with family members. And it was a calming moment when the chaplain walked in. I can't even explain why it was different, but just having that presence was just phenomenally important, and it had a volume of impact for the elder, for our family member, and for the family.
And well, let's talk about that. I know we've got about 10 minutes left, or maybe. How much time? Okay. This is really the crux of it. And Kath, you're really the expert here, because I'm looking at some scriptural basis for spiritual involvement in care and healing. So let's just go through these, and then I've got a really important question for Kathy, and of course want Dan's opinion as well. But if you look at Deuteronomy 7, the Lord will keep you free from every disease. Let me repeat that. The Lord will keep you free from every disease. That's really powerful, and our stakeholders and our clinicians, I pray that over you right now. I ask that on your behalf right now, free from every disease. It's in Scripture. It must mean something, right? There's good news in that. In Jeremiah, I will restore you to health and heal your wounds, declares the Lord. I will restore you to health and heal your wounds, in Jeremiah. Powerful. Heal thy wound in Psalms, and of course, it's a lot of the healing scripture in the New Testament. Jesus healed all. I mean, there's a quality about all, healing all wounds. So what I really want to talk about is care planning, formally care planning, chaplain interventions, but not so much so that we get so specific where, so let's talk about the intervention and making it formal, and aggressive is not the right word, but doable and tactical. Doable and tactical.
Very well said. Very well said. I think that, as we all know, with our care planning process, it is important to capture what we do, and that is one of the locations that we can actually be able to demonstrate our interdisciplinary process and include our chaplain in that process in a formal way. But we have to be a bit on the cautious side, not to get too specific, as everyone knows, because if it's on the care plan, it better happen, right?
Exactly.
And we also want to make sure that we're allowing enough latitude to be flexible in the moment with the resident and the elder. So I have found, and I've actually checked this out with some of my senior clinicians to make sure that they're in agreement, that care planning with statements such as, a spiritual intervention as indicated, and then that way, depending on what the issue is, it could be applied in the way that's specific to the need, or a prayerful intervention as indicated could do the same.
So the language is?
So the language would be spiritual intervention by the chaplain as indicated.
Spiritual intervention by the chaplain as indicated.
Or a prayerful intervention by the chaplain as indicated. So, for example, if you have a skin issue or an at-risk for skin breakdown or a nutritional issue, you could actually just put a statement that is fairly general, but it still demonstrates that we're bringing to bear something that a lot of facilities, and probably the majority of facilities in the United States, are not doing, is bringing to bear that influence of our chaplain. And we are recognizing our chaplain as an incredibly valuable member of our team.
They are a part of the IDT?
Absolutely.
As one of the DONs said, God is part of her IDT team. I love that. She goes, God is a part of my IDT team. There's no question.
That's right. It was good. I would like to ask Dan.
Absolutely.
Dan, how are you capturing this process in the care planning process at Laurelwood?
Well, I was kind of afraid when you spoke that I had been doing it wrong, but, you really hit the nail on the head. The actually care plan for this, it was the gentleman who had fallen the 8 times, and the nurse came to me and said, how do I write this? And I had to sit back and think about that. And then I thought, well, we always do psych eval and treat, and I'm lucky enough to have a respiratory therapist, so we do RT eval and treat. So I literally wrote it as spirituality, evaluation, and treatment as indicated. So it's pretty close to what you did.
Say it again.
Spirituality, evaluation, and treatment as indicated. And I can tell you that
Spirituality and evaluation. Wait, spirituality
And evaluation. Spirituality, evaluation.
And treat as indicated.
and treat is indicated.
Very good. That's great. That's great. Very well said.
and they said that was okay.
All right.
So you had a survey. Listen, team. Dan's had a survey. They saw the language. They said it was okay. We're good to go. Press the button, green. We can listen. I mean, and also, I would say that this is. I mean, look at Dan's joy. There's an element where DON clinician team, we love you so much. This is a tool. This should be a part of your tool set. This should be a part of your intervention toolkit, which will expedite the healing process, or expedite the soothing process, or expedite the emotional healing process of the patient and the resident, making your job easier. We want to make your job easier. It's a tough job, comorbidities, angry family members. I mean, so there's so much. This is part, Our goal here is to make it part of your toolkit and very tactical and practical. So really think about spirituality as part of your armor,
Absolutely. A valuable part of armor. I would argue to say that if someone would need to move on because of life circumstances, but not because you want to move, we don't want anyone to leave, but I bet if you are used to having a chaplain and then you no longer have a chaplain, you're going to feel that void, because it's just so powerful in our world. So I think of it that way. I always think of, how do I capture what I appreciate? And one of the ways for me to capture is if it's not there anymore. And it's almost like, wow, I am so excited to have this partnership.
This is the best.
It's really, it is. And it's a wonderful investment from Signature and Joe and the board. I marvel at it every day.
We love our board, absolutely, yeah.
Absolutely.
And again, remember our pillar. It's the freedom to choose. It's the right to worship or not to worship, but the freedom to choose. We meet you at the point of your spiritual need, and that's where the beauty of this interfaith model comes from. The new assessment work that Amy Phipps talked about, around MDS. The better we know our patient, the better the intervention can be. Not just on a clinical side, but also on a spiritual side. So, where's our time?
Can I just
Please
quickly say one more thing? Of
course.
I just also want to acknowledge the important relationship between social worker.
Oh yes,
and
we love
chaplain,
our social. Yes,
because there are some overlaps there,
and the
as well as
psychosocial.
with the psychosocial piece. And I want to say I appreciate so much our chaplains have worked so well and partnered so well with our social services departments and
Yes.
social workers. It's a very important synergy between those two disciplines. So.
It is, yeah, and really, and we've learned even quality of life, all of it, because that's the
Yeah, quality of life
ambulation
too.
and the joy and the spirit. We love all our partners. We love you guys. We're praying good things. The tentacle of the spirit of prayer is coming to you through the portal of the camera into your centers and into your halls and into your heart. And we just pray for the desires of your heart and an overflow of blessings, pressed down, shaken together to overflow, and full protection. We love you guys. God bless you.
Thank you, Dan.
Thank you, Dan. You're brilliant. Mwah.
Happy Dianne. It was wonderful. Thank you.